Hey guys, Dr. Malcolm here, board certified gastroenterologist and internist, to talk to you today about which antacids to buy when you go to the pharmacy. It's almost overwhelming when you go into the digestive aisle. All that and more after this. In today's episode, we're going to focus on over-the-counter antacid treatments. We're not going to talk about your proton pump inhibitors or your PPIs, which is your Nexium, Prilosec OTC, and your Prevacid. We're going to reserve those for the next two episodes. Today, we're going to focus on your local therapies and your histamine blockers, your H2 blockers. So let's jump right into it. The first category that I want to go over are your local therapies. So your local therapies include Pepto-Bismol, Alka-Seltzer, Gaviscon, Rolaids, and Tums. These products are primarily coating and neutralizing agents. They immediately bind to acid and neutralize it in your esophagus and in your stomach. So if you have symptoms that come on quickly and you want to relieve them quickly, maybe these are the best medicines for you. Their downside is that they don't last long. So if you have sustained symptoms more than 20 minutes, you might need a different choice. The first medicine that I'll go over is Pepto-Bismol. The active ingredient is actually bismuth, and bismuth is a coating agent. Sometimes it will coat irritated tissue in your esophagus or your stomach. Alka-Seltzer is a great medicine because it's been around a long time. I have a lot of patients in my practice that swear by this medicine. The next medicines are your Gaviscon, your Rolaids, or your Tums. Your Gaviscon, it's aluminum hydroxide. Your Rolaids and Tums is a calcium carbonate mixture. These medicines all neutralize and coat as they go down. They are all local therapies that work really quickly. The next medicine category that I want to go over with you are the H2 blockers or the histamine blockers. These medicines are highly effective and they work quickly. They take about 20 to 30 minutes for them to work, but the great thing about these medicines is that they last for about 8 or 10 hours. The medicines in this category are Zantac. The generic version is also called ranitidine, Pepcid AC, which is also called famotidine, and Tagamet, which is also called cimetidine. All your big local pharmacies will have generic versions of these medicines, and you might be able to save yourself a few extra bucks. You would take these pills when you had more severe symptoms. You would take these pills when you have new symptoms from acid reflux, or you would use these treatments if you have sustained symptoms, meaning you're having more than 1 or 2 days of symptoms per week. The other reason that I like these pills is that you can take them once in the morning and once in the evening, and it really does give you great 24-hour coverage, and it works quickly. A lot of my patients have a lot of nighttime reflux, and I tell them to take Zantac, Pepcid, or Tagamet before bedtime in a higher dose, and this will help control their symptoms while they're sleeping. If they wake up in the middle of the night with immediate symptoms like regurgitation with heartburn, I'm going to recommend a local treatment because it works quickly. So guys, I hope that you learned something in today's episode, and I hope that going to your pharmacy and finding treatments for your acid reflux symptoms is a little bit easier. Just remember that we didn't really go over side effects of these medications, but of course there are side effects to every medication that you put in your body. So I really encourage you to read package inserts, talk about these medicines with your local doctor, and follow the instructions on the packages. Don't forget to like and to subscribe to these episodes. In next week's episode, we're going to focus on the PPIs or the proton pump inhibitors. Just remember, I'm here to serve all your digestive needs and gastrointestinal issues, but this video is not a replacement for seeing your doctor. If you need to discuss these issues further, I hope that you find your local gastroenterologist. Until next time, I hope you feel better.